So welcome everybody to today's meeting. Um, this is the Sustainability Workshop Series, Creating a Legacy, and today is the first session. We're really glad that so many of you are interested in this topic and so many of you could join us today. So my name is Julie Eben. I'm a Senior Prevention Specialist here at FPRC. And Sheila, can you introduce yourself?
Yep. Hi, everyone. I'm Sheila Krishnan, and excuse me, I'm a campus prevention specialist here at SPRC.
Great. So before we get started, I thought we could do a short poll just to kind of get a sense of who is in the room. So I'm wondering, uh, where folks are at in terms of sustainability planning. So go ahead and put your answer into the poll. If you haven't started yet, or just getting started, or already working on it, anywhere is totally fine in the spectrum. I'll give folks another minute or two to put your response in. Great. So Dominique, can you close the poll and broadcast the results? Oh, looks like one more snuck in under the wire, or another two. um, so it looks like a few of you haven't started yet, but you are here today, which is wonderful. About half of the rest of you are just getting started, and half the rest are already working on it. So that's great to get a sense of, the range of where people are at. And we're hoping that for those of you who have already started, you will be able to, share some of your wisdom with the group as we go along. And really, no matter where you are in starting or not, you have what you need to succeed at this. Your presence here shows your motivation to start the process now rather than waiting until the last minute, which can often be less effective. And that will really help you to succeed. And your team has a lot of skills already in planning, making partnerships, thinking creatively, and a lot of passion. And these will also help you succeed. So Dominique, can you take the poll away? I wanted to just give a brief overview of the series. So we will go from creating a vision of sustainability, assessing your activities, prioritizing where you want to focus your sustainability work, strategizing on how to do that, addressing any gaps that you might have for sustainability, creating an action plan, and then hopefully beyond putting it into action after this series. During today's session, going back to the overview, so there are 4 meetings. Each meeting will focus on one sustainability strategy or theme in particular. So today's is around communications for sustainability. The next session is on partnerships. August 5th is on infrastructure, and August 19th is supporting trainers. The format is a little bit different from what you may be used to from SPRC. It's more like a workshop and less like a webinar. And we hope you'll get a lot out of it. So please tell us what you think about the format. We will have some brief speakers who will share their experiences and wisdom around sustainability. We'll have some group discussions, some group and solo work. And we also have homework, I know. And this is a snapshot of the homework list. So definitely review that guide, and you should have all gotten that over email. If you haven't, let us know and we'll definitely get it to you. And we also, there's going to be an opportunity for partner input, a peer input. So we sent you a list of buddy sites, and we'll ask you to connect site to site in between sessions so that you can ask each other questions and give each other feedback about your worksheets. Some of you are in different places, as we've said before. We hope you will share your wisdom. Some of the peers that you may be paired with might be out of the office today and or this week. And so if that's the case, please talk to your PS instead of your peer buddy if you want feedback on the first week's homework. So that's the series overview. Today's session, we're going to look at what does sustainability mean overall. And then, as I mentioned, the strategy of the day is communications. Many people are not sure how to communicate with partners or stakeholders, community at large, about sustainability, how to keep them engaged, and supporting suicide prevention after the grant. And that also includes potential funders. So we're going to hear some examples of communication strategies from a grantee and an alumni grantee. And then we'll keep the bigger picture in mind and kind of see how to do that as you start to get into the weeds of planning for sustainability so that you don't get lost in those details. And that's what we're going to be up to today. I'm going to turn it over to Sheila.
Sounds good. Thanks, Julie. So I want to get us started by just trying to clarify what we mean by sustainability. And I realize I put this image up there and that often we refer to sustainability in terms of the environment, and that's not what we're talking about today. But looking at some of the responses that people gave in the chat and the lobby. So I think some people mentioned taking suicide prevention to the next level, making sure that you're continuing your grant program through collaborating with partners afterwards, and then making sure that key stakeholders on your campus or in whatever setting you're working on really see suicide prevention as essential to sort of the core mission of what you do. So we'll really be discussing how we can keep suicide prevention going after the grant, maybe regardless of particular grant activities. So it might not be sustaining your activities sort of activity for activity, but really building an infrastructure and making sure that suicide prevention overall continues to be a priority. And I think one thing that we've learned is that it's really not a one-size-fits-all model and that it will look very different in each of your communities that you're working in. But we hope that really being intentional about making sustainability a priority from the beginning will help you to sort of develop that sustainability mindset that you might have read about in the sustainability report that we had shared. Before we do that, though, I do want to kind of back us up a little bit and talk about when you're thinking about what does sustainability mean to you, what does it mean to continue suicide prevention work, it's important to have some sort of vision for what that looks like for yourself and some sort of way for you to keep inspired in doing this work and some picture of what doing a good job or being successful in our efforts to prevent suicide actually looks like. And so I wanted to share this as a piece of sort of information that I use sort of to keep me focused on what our goals really are. So this is the dedication from the 2012 National Strategy for Suicide Prevention. And when we were talking about this session, I remember that I actually have this cut out and stuck to my computer, my work computer, so that it's something I kind of see every day. And I think that this just really helps me to remember what is the end goal that we're working for, who are we working for, and things like that. And your vision may look different, what inspires you may look different, but I think we're actually just going to take maybe just a moment right now. We're not going to ask you to share it or anything, but if you could really think about what this would look like for you, what your vision is, and having it written down so you can keep it front and center is an important or a helpful tool sometimes to do. So I'll just give everybody maybe a moment or two to write something down that you might be able to keep with you. Okay, so hopefully you were able to think of something to write down, and if not, I think sometimes it's a helpful exercise to maybe do on your own to think about sort of refocusing what are the outcomes and what's the vision that you see for the work that you're doing. So I hope that many of you were able to read just the first few pages of the sustainability report that we had sent out as part of the pre-work for the session today. The Leaving a Legacy report was a report that SPRC compiled about a year ago that involved some interviews and some surveys that we did of alumni grantees to really learn from them what were some strategies that they had used to help sustain their suicide prevention work, what were some key things that they had been able to continue. And I think it was encouraging and promising to see that a lot of the grant sites that we talked to were still doing some type of suicide prevention activities over a year after the grant was over. So we'll be pulling a lot of the lessons that we learned from this report, but I encourage you to take a look at it in your own time as well. And some of the key things that we learned from the alumni grantees were this list of 5 recommendations. So adopting a sustainability mindset was a key piece, which we'll be hearing about a bit today, but how planning for sustainability from the beginning is really important. And then the other ones you would have seen in the executive summary as well. And I will pass it back to Julie.
Thanks, Sheila. So we're now going to hear from some of our fabulous guest speakers, and they're going to be just share briefly some stories of their successes in sustainability communication. And as they're sharing their stories, what I'm asking you to listen for is who are they trying to reach? Um, what's their intended audience? And what are their communication goals? Um, so first, I'm going to invite Misty Allen to unmute herself and to share her story. Maybe Misty, just introduce yourself in terms of your position and when you held the grant and where you were located.
Great. Thank you so much, Julie. Hi, I'm Misty Allen, and I'm the Suicide Prevention Coordinator with the State of Nevada in the Division of Public and Behavioral Health. We ended our grant in 2012, but the state picked up where the grant left off, which was so wonderful that they felt the buy-in of continued support of the Office of Suicide Prevention. So what I'm going to discuss related to communications is cultivating champions. Cultivating champions across Nevada and in different environmental, cultural settings has been crucial to the success and continuation of our grant programs into sustainable suicide prevention efforts. One of the first champions, and she still continues to be one of our major champions, is Christy McGill, who is the director of the Healthy Communities Coalition in a small rural county in Nevada. We connected with Christy after an alarming increase in deaths by suicide in her county. It was impacting first responders, law enforcement at a great, great level. So they reached out to bring us in and work with their coalition, which is a very vibrant public-private partnership of community entities from the Sheriff's Department, all the schools, mental health, public health, and they continue every meeting to have at least 50 partners in the room monthly. So we came in 2010 to develop a suicide prevention strategy to address their alarming rates. And the community instantly bought into this strategy, supporting and participating in our gatekeeper trainings, public awareness campaigns, and school-based screenings. So we were hitting the community at many levels to work with this comprehensive strategy locally. At that point, we had Garrett Lee Smith funding that supported our efforts with training and screening. But as the grant wound down in 2012, we found other partners to support their screening efforts. What Christy did is open doors within her county, especially with the school district superintendent and school boards, to the point that they committed to all 18 schools be participatory in the screening programs, middle and high schools. We had all 18 done in the first year. They continue to do that. They're in their third year of screening because they are so bought into the efforts. The coalition has helped us with communicating our messages by making suicide prevention a discussion point at every monthly meeting, even if it's just a brief update on what's happening. And I feel that that's allowed suicide prevention to become a piece of non-traditional settings. And I think currently they seek their own funding to continue this effort. And we really offer our support, our time, our technical assistance, but they are self-sustaining with a competent workforce around suicide prevention, and they have written numerous grants related to youth mental health and improving access for youth and families. My second champion is the First Lady of Nevada, Kathleen Sandall, who also works as a full-time director of operations for the Children's Cabinet. She already was a champion of youth mental health first aid, but we got connected with her after a press release she sent out December 2011 in response to the national and state increase in youth suicide deaths. At that point, she pledged her commitment to raising awareness and finding resources for mental and behavioral health for our youth. She was a national champion, as I mentioned, from her work at her nonprofit. And so we connected as she was seeking ways to increase early identification for mental health in youth and suicide, as well as improving access to help families. She offered her team in support of our school-based screenings in this previous rural community. And that included clinical professionals, mental health professionals, and other youth staff to help as the screening team. And the other amazing piece of this, for families that could not afford care, they offered low or no-cost mental health counseling for those youth that might have screened positive. After witnessing the success of the screenings, Ms. Sandoval reached out to our school district up here in the north in Reno to build support around school-based screening in Washoe County. In fact, to the point of yesterday, she was meeting with the school district to expand and advance screening efforts, as well as improve upon training school staff. So we are discussing partnering with her staff to become trained trainers as we roll out a new bill that was passed in our last session. SB 164 mandates that all school administrators and boards must be trained in suicide prevention. So we're going to partner at doing that effort statewide. Our third wonderful champion is the Adjutant General of the Nevada National Guard, General Burks. The Office of Suicide Prevention was working with the Nevada National Guard chaplains, who are assist applied suicide intervention trained caregivers, in trying to train the entire Guard of Nevada. But we really needed that support from the General. It took a long time, but we got the General to commit to 2 days to participate in the assist training, and he brought 80% of his leadership with him for those 2 days, and it was one of the most phenomenal experiences. He fully participated the entire time, completed role plays, and after that experience said it was one of the best trainings he had ever been in. And so they have supported our efforts for quarterly assist trainings with the Guard in both Las Vegas and the North that we continue to do. And a piece of that sustainability, not only the General communicating his support for these efforts and mandating that his soldiers and airmen participate, he funded train the trainer events for Safe Talk. We were able to train 30 airmen and soldiers as Safe Talk trainers so that they could continue to perpetuate giving Safe Talk skills to their workforce. So how the Office of Suicide Prevention maintains and nurtures these relationships, truly, besides offering our technical assistance and support, we cultivate trainers within these agencies. And what you probably all know from suicide prevention, it is very difficult to find trainers. It's a difficult subject, and if you're not doing this for a living like we do with the Office of Suicide Prevention, we have found people hesitant to get out there and do the training. So we co-train with them and mentor them throughout until they are comfortable with their materials, comfortable with working in their communities or on their bases. And that has led to reaching out when needed, when they need any technical assistance or have ideas for future grants. They know we are here to stand by them and support, not just financially, but literally, emotionally, and physically to make sure we can get the job done together. And I just really see the benefits growing because they trust the Office of Suicide Prevention to stand by their sides as they communicate their support for these efforts. I think it's also benefited that funding, any little pockets of money that are left over, they send to the Office of Suicide Prevention to support these efforts. So buying training materials, buying screening kits has been very easy and also adds to the nurturing of these partnerships. I think that's it for Nevada.
Great. Thank you so much, Misty. We're going to hold questions until after the speakers, but if you do have a question, either jot it down for yourself or jot it down in the chat box, and we will come back around to those questions. So now I'm going to turn it over to Greg Elliot at Adams State. And Greg, can you also introduce yourself and when your grant is ending and where you're located, et cetera?
Sure. Thank you. So hi, everybody. My name is Greg Elliott. I'm the Director of Counseling and Career Services at Adams State University and the Project Director for our Garrett Lee Smith Campus Suicide Prevention Grant. And we got our Garrett Lee Smith grant in 2011, so we are just in the process of wrapping up our 3 years on that grant project. And I guess if I was going to name what I'm going to be talking with you about today, it would be to start early and to know your audience. So Adams State is a nominally state-funded university in south central Colorado. We're at about 7,500 feet, very close to the New Mexico line. We're very rural, fairly isolated. The closest four-year college campus to us is about 2 hours and 15 minutes away in any direction. And pretty low socioeconomic status of our students. And the state of Colorado has cut higher education funding almost to the extent that we're barely funded anymore. So the budget is a big issue for us. And so when we were granted the GLS grant, it primarily funded a full-time position to do suicide prevention on our campus. And one of our immediate goals from the very outset was to figure out over the next 3 years how we can keep this position and keep the work going. So we started immediately, and knowing sort of at the administrative level who makes those decisions about, you know, weighing, do we keep this position, do we cut this position, and how those decisions are made, we targeted a lot of our communication either directly at some of those administrators or around them such that they would get the message even if we weren't talking directly to them. So one of the key strategies that we did is we put our prevention coordinators' face and name on almost everything that we did, and you've got Laurel's picture there. And that looked like a lot of different things. Laurel worked with our undergraduates to get a club going. We would advertise and market those activities. Basically, every time we did a prevention activity on our campus, whether it was our 1100 Reasons to Stay Alive and Connected or our Hope Wall or some of these projects that we did over the 3 years, we saw any of those events as an opportunity to get it in the newspaper, to get it on the radio. Just as an example of sort of how we jumped on the marketing and the communication directly to the administrators, but a couple of years ago, the National Suicide Prevention Lifeline put out a call that they needed volunteers for their advisory board. And there was a little application process that you had to go through for that. So we put Laurel's name in for that, and she was selected to serve on one of their advisory boards. So we made a very big deal about that on our campus. It ran in the local newspaper. It ran in the campus newspaper. She was interviewed on the radio about it. And we just allowed the perception to be that that was a highly competitive position, you know, and sort of a recognition of the work that we were doing on our campus. And really, the communication strategy to those administrators was we very specifically wanted to put them in a position at the end of the 3 years where they didn't feel like they could reasonably cut the position because of the importance of the work that was being done by it. And as a second piece to that, after they decided they can't cut it, that similarly they couldn't subsume it. They couldn't say, well, we're going to eliminate the position, but we'll have this other person do the work, because it was too big and it was too important and it was too broad that any other person could possibly pick that up. A couple of the other strategies that we used, of course, SAMHSA had us capturing a variety of different data points to report into their track system. We made sure that that data was communicated on a monthly basis to our administration so that they would see, the impact, because we live in a fairly small rural community, about 9,000, 10,000 people. We wanted them to be able to see that, the reach of what we were doing from a suicide prevention standpoint was not only blanketing our campus, but it was reaching out into the community. We have a very high suicide rate in our community. So we wanted them to be able to see that, we were making an impact on campus and in the community, and obviously the work that we were doing is also attached to our university, which helps market the university. And then late in the 3-year grant cycle, Laurel actually left us, which is somewhat normal, I guess, for, in SAMHSA's experience. They said not to sweat it. A lot of people, when their positions are funded by the grant and the grant is winding down, we see people leaving. But around the same time, our disability services coordinator left, which is a completely separate position. And just to make sure that we sort of sealed the deal on keeping the position, I agreed to take disability services back, to take those responsibilities on. What we were able to work out with the administration is we would keep the position fully funded by the university. They would spend half their time doing the prevention work that we'd been doing for 3 years. The other half of their time they would spend doing disability services, because obviously, as a federal requirement, we had to have those services provided on campus. So ultimately we were successful, just sort of bartering with the administration. We had to take on a few more additional responsibilities, but we're excited as we sort of move out of the funding period that we've been in, that we'll have the opportunity to continue doing the suicide prevention outreach and intervention work that we've been doing on our campuses. And I guess the other thing that we did, and I'll just say this briefly, but we were able to participate in one of the communities of practice that was sponsored by the SPRC on rural suicide prevention. I'm kind of feeling that we had some experience and some expertise that we could share with that. One of the ideas that another campus brought up with that in communicating the suicide work would be through the counseling center, which rolls up under me, just to count the number of discrete encounters we have with people that have to do with suicide. So, we may have a person who's struggling with suicide that comes in 50 times over the course of an academic year. Each session deals with suicide. We would count that person 50 times and just somehow figure out a way to keep a tally on the number of interactions that we have with people around suicide, and then report that number at the end of the year back to the administration next to the number of deaths by suicide of our students, which hopefully is very low, 0. Because I think a lot of times from an administrator standpoint, they see, well, no one's killing themselves on our campus anyway, so we must not have a problem, and they sort of dismiss the work that's going into making sure that we don't have anyone killing themselves on our campus. And if you can show, hey, on our campus, and we have a small campus, we had 375 different interventions with people related to suicide, and hold that 375 number up against the 0, then they can kind of see, well, we do have an issue with suicide on our campus. We're just doing a really good job at preventing suicide on our campus. And so that's one of the strategies that we're going to take out of the GLS work that we did and our work with the SPRC, and continue that into the next academic year.
Thanks so much, Greg, and thanks for the shout out on the community practice. And again, to folks, please hold your questions, but if you do have them, you can feel free to jot them down in the chat. I'm going to turn it over to Sheila again to share a little bit about one more grantee story before we sort of talk about more broadly about the communication strategies. Sheila?
Great, thanks. So the example that I have to share is from the School of the Art Institute of Chicago, who is in the same cohort as Greg. They were funded in 2011 and are finishing up with their grant now as well. And one of the things that they have done a pretty good job of from the beginning of their grant was to be really data-driven and really focus on gathering data about help-seeking behavior among their students. So they participated in the Healthy Mind Study, which is a national survey of college mental health run out of the University of Michigan. And so they did that in the year before their grant, and they plan to do that again after the grant is over so that they have some comparison data that they can look at. And one of the things that they found when they did that survey on their campus was that all of the art schools who have done the Healthy Mind Study all ranked at the highest amount in terms of prevalence of mental health distress, so anxiety and depression and some of those things. And so they invited Daniel Eisenberg, who's the lead investigator on that study, to come to their campus and speak to their administrators about some of the findings that he was seeing across the art schools as well. And they really used that opportunity to make their case to their campus administrators about saying that we have a unique student population and we have these issues and there really is need for more mental health support. And there was an existing data analytics committee on their campus that was kind of an existing body that allowed them and provided a venue for them to communicate their data and what they were finding to campus administrators so that they were able to kind of continuously have communication about what was happening and what they were doing to address it. And the example that you see on the screen is that they actually had a piece about their Healthy Mind Study data and more broadly on mental health on their campus run in the Student News magazine. So they did print some of the sort of pie charts that you can see there from their data that shows the prevalence of different mental health issues. And so this was another way that they used to communicate that data not only to their campus administrators, but to the campus student body at large, so everybody had an idea of the sense of the problem. And so one of their successes in having this sort of ongoing communication and having data to back up what they were doing is that they've been able to sustain their mental health promotion specialist position after the grant, so she will continue on. And I know that another thing that campuses have mentioned and that you'll see in the sustainability report is that often what you call the position as a part of the grant can help in how you communicate how essential they are to campus. So sometimes calling the position a GLS grant coordinator kind of makes it seem like it's very attached to the grant funding and that it might end when the grant is over, but calling it a mental health outreach coordinator or a mental health promotion specialist helps to sort of really make this that this is an essential position that campuses need to have or that our campus should have. And so I know that I've heard that from other campuses and alumni campuses that were interviewed for the report. And I think the other thing that's important, which Greg shared a bit, and I know that SAIC has done, is just to make sure that you're communicating to the key stakeholders on campus. Make sure you identify who they are, whether it's the Director of Student Affairs or the Chancellor or whoever that person that's in a decision-making position might be, not only on your campus, but in whatever setting that you're working in, and then what are the avenues to kind of continue communicating with them what you're seeing and what you're doing and how what you're doing has an impact on preventing suicide in your setting. Another quick example I have from another campus also talked about communicating from the first year of the grant by doing a lot of presentations. So presentations with the Board of Directors or the Board of Regents for the campus, presentations with faculty, and really having reports that show what the outcomes are, how many people were trained, and so that you're showing that the mental health outreach coordinator is doing all of this work and engaging students in all of these ways, and it makes it more difficult for the person in charge to eliminate that position or to really take that away when so much buy-in and support has been generated around their work.
Great. Thank you, Sheila. So I'm curious if folks have any questions for Misty or Greg or for Sheila about these examples. And you're all muted right now, but to unmute yourself and then later to remute, you can press *#. And if you're not sure, is it my turn, etc., feel free to use the hand raise icon that you can find at the drop-down menu on the top of your screen, and then we can call on you. Or also feel free to type your question into the chat box if you have one. So there are no questions for the presenters right now. Oh, I see one being typed in, so we'll give that just a moment. And after the questions for the presenters, we're going to debrief a little bit about their stories. And so as we're getting the questions for the presenters, you can also start thinking about what did you notice about their communications, what were their goals in communicating, and who was their intended audience for their sustainability communications. Okay, so I see that Linda, you have your hand raised. So go ahead and unmute yourself by pressing *#.
Hear me?
Yes.
Okay. So this is for Julie. I think you were saying that at SAAC you had frequent communication with decision makers, and I think that's a fantastic idea. I wondered if you had strategies. It can be a little hard to get the airtime from the decision makers. You can't just call them up and say, "Can I come to your next meeting?" So, did y'all have any strategies to get on the calendars or the agendas of your administrators or your trustees?
I'm actually going to ask Greg, it sounds like you were able to get some of that airtime as well. Is that correct? Do you want to say more about how you did that?
Well, again, we work on a somewhat smaller campus, and so as opposed to maybe a campus where you've got 30 or 40,000 students. I mean, I know most of our administrators on a first name basis. So really, our strategy was just to make sure that they were aware of the work that we were doing, and that could be through monthly reports, or in my case, the counseling center is actually on the same floor as the administrators, and so I would maybe catch them in the hall or pass them in the hall and say, hey, did you see this thing? It would mean a lot to us if you could come by and say a few words. We're unveiling our Hope Wall, or we're doing this event on campus, and it would mean a lot to the undergraduates if they saw you participating in that, reaching out to them that way so that they're aware of the work that we're doing. Again, kind of towards those two goals, that when they have to make a decision about what they're going to do with the budget, no one's really willing to say we need to cut the suicide prevention work because they know that it's too important and it's making too much of an impact. But on a small campus, it's really easy for us to do that because we do have personal relationships with the decision makers.
Oh, great. Okay, thank you.
Do other folks who are in the audience here have any strategies that you want to share around how you were able to get that airtime with decision makers, whether it's a campus administrator or a politician, or somebody who controls some of the budget locally?
And Julie, I would just add, while people are thinking on that we in Colorado, they just passed a bill that went through the Senate on establishing a commission for suicide prevention in the state. And I did reach out to our senator here that represents the San Luis Valley, and that email, again, that went through our governmental relations, and they said it was fine for me to contact him, but kind of twofold, to make sure that he understood at the legislative level all the work that we were doing at Adams State related to suicide prevention, and then just asking him to support that because our suicide rate is so high down here in this area, and letting him know that we're doing all this work on campus, but it impacts the community as well, and we really want you to support that project. So we reached out directly to him.
Great. Thank you, Greg. Well, while folks are thinking, if you have any further strategies like that, I see Rachel typed in that they invited their vice president or vice provost for student affairs to be a key member of their crisis protocol task force, so they kind of loop that person in. We're also going to be talking next meeting more about partnerships as well, so there's a lot of overlap there. And I see that some other folks are typing in some thoughts, but while they're doing that, there are some questions about the screening tool and having the resources, but I really want to make sure that we stay focused around the communications for sustainability, because I think that there are probably a lot of details that we could get into around, how the screening itself worked and how to set that up, but I feel like that's probably a little bit of a different conversation. So I'll just recognize that that's an important concern of if you start doing screenings, will you have the resources to respond? And then how does that work in terms of sustainability? After the grant funding ends, how can you support perhaps increased volume from the screening? So Missy, I don't know if you want to maybe speak to that angle a little bit.
Absolutely, and they can contact me for any details of the screening
Great.
program. We're moving into our 4th year with that. The focus, absolutely, the fear behind screening, these champions had so much respect and trust within each of their distinct communities that we would educate and support the champions, and then they had the communications with the superintendent, with the Board of Education, with the local districts that bred confidence in these school districts. And it was really making sure that the screening teams were well equipped and trained. So once again, while we are in there doing intensive partnership, once we feel they're confident, we completely back off, and we're really there with as much support or as much space as each of those communities needed. So that trust is what allowed for the screenings to occur, and it was the champions communicating with their decision makers. If that helps,
Thank you,
Julie.
Miss.
Did that make sense?
Yes, thank you. So I want to throw out to everybody, to ask, in listening to the stories, what were the goals and who was the audience that they were trying to reach with their communication strategies? A lot of times we can think of communications as, to the sort of general public, or if you're on a campus, to your student population, but this is sort of more to other audiences. So Liz typed in that the program that she works for is an urban area focusing on the Native American community, and she's reached out to the director of Native American program in their public school area. So that's a great way to try and get airtime. So I'll give some examples of audiences that you might want to try to reach for sustainability. In this case, one of the audiences that Greg was reaching out to was the campus administration. Misty was also reaching out to, in the case of using the champions, in the case of the adjutant general, the audience was also, the other leadership at the National Guard in Nevada. Any other thoughts on either who their audiences were or what might be an audience that you might want to reach out to for sustainability, to communicate with for sustainability? I see some folks are typing in. And feel free also to, unmute yourself and speak aloud by pressing *# or raising your hand if you want some help navigating the when to speak. So Judith chatted in community agencies, both clinical settings and non-clinical. So those might be some places that you would want to communicate for sustainability. Judith, I'm wondering if you can say a little bit more about that. Like what would be your goal in reaching those particular places for sustainability? So maybe you can unmute yourself by pressing *#. I think you may still be on mute. So it may be hard for Judith to get on the audio for whatever reason. Laura chatted in schools, and Casey Cohen typed in an advisory board for a suicide prevention program, including key members such as residential life, student support services, the dean, ministry, etc. Judith, to unmute, you can press the star key and then the number sign or pound key on your phone. Lori, oh, go ahead.
Oh, sorry, this is Judith. I was having trouble getting off on mute. Sorry.
No problem.
I think your question was about the clinical and the non-clinical settings that we've reached out to. I think our messaging to the community has been really important for us because we've been trying to create a little bit of a collaboration as well to get the word out into the community, which we found doesn't have very many suicide prevention resources either. So we have a lack on campus, but also in the community. And we're kind of a community-based campus. A lot of our students grew up in the area and live in the community. So we wanted to reach out to a variety of places in the community where we could provide suicide first aid.
Great. Thank you. Jonathan also chatted in to talk about the progress of the program and also how the program impacts the campus, or in some cases how the program impacts the community. So if you're really able to show what effect it has, I think that that is a very helpful strategy for communication. So such as Greg talked about, how, both with your track or your cross-site data, such as how many people trained, how many people have seen certain messages, et cetera, as well as if you have any local evaluation or impact data, such as number of people who successfully got into some kind of mental health services as a result of, say, a gatekeeper training, or this many number of partnerships were formed, et cetera. Lori, you mentioned schools. Can you say a little bit more about that? And again, to unmute your phone, press the star key and then the pound key. Lori Sunchild, you are still on mute if you are trying to speak. All right, so Lori may be having some trouble getting off of mute. I just want to throw out some other ideas of audiences that you might want to try and reach. Casey chatted in also about a foundation that they connected with. So in thinking about communicating for sustainability, you might want to reach out to your champions, your partners, your volunteers, tribal council members, elders, other local health partners, maybe Indian Health Services. And this could be, in thinking about your goals, this could be to sort of strengthen your connection with supporters and keep them engaged. It could be, showing the need as the School of the Art Institute did, and really documenting those stories and those data as early as you can. It doesn't have to be hard numbers. It can also be stories of success of particular individuals but that really will show that there's a clear picture of need and a clear picture of success. And you can use that to show to potential funders and your supporters. So some other folks chatted in Mental Health America of Hawaii representatives, so potential partners, and also with the state and regional suicide prevention coalitions. So that's great. And again, we will also talk more about partnerships next time. So I'm going to transition, move on now to, oh, actually I wanted to mention one more strategy and also a resource. So Kentucky Cabinet for Health and Family Services used the strategy, and this was really to get into schools in the first place, but I think it's a really great way of using peers, and you can do this for sustainability as well. They created a video with school staff and administrators sharing their experiences of dealing with the aftermath of student suicide, but the video really emphasized the importance of educating staff using gatekeeper training programs and screening with evidence-based programs. And they have used, those stakeholders speaking to convince other folks that they also need to be doing suicide prevention. So that's really helpful. And we'll send the link to that video with the information about the recording for this. As well as on the FPRC grantee pages, there are some great communications tools, and we'll put the link to that in the chat and also email that as well. Jennifer, I really appreciate your comment. Is one of the themes included the need to showcase what you're doing so that it's difficult to cut the program later, and I think that that's definitely true. And Lori's asking if anybody has plans in place with sustainability and if there are ideas that can be shared with all. And so that's part of our effort throughout the series, is to bring in the different speakers who really have done stuff that has been successful. And we're going to be going through some of the strategies, some of the ways to create plans. And hopefully folks will be able to share what they have in place as well as we go along. So I'm going to turn it over to Sheila now to talk about the next piece around creating a plan. Sheila?
Great, sounds good. So this is the big picture worksheet that we asked you to pull up from the sustainability workbook that I emailed out earlier, and that some of you may have accessed through the private pages on the SPRC website. So I just wanted to emphasize that the workbook has a handful of different worksheets that we'll be working through throughout the series, but the importance of having a written plan can really be helpful for a few different reasons. I think people who have created a written plan have found that it's helpful to walk through the process to create something really concrete when you're thinking about sustainability, because I think we all generally have some ideas of what we hope to find, but being able to get something down and write it kind of helps you to solidify the nitty-gritty details. And the other thing that having a written plan is helpful for is to help in your communication with your stakeholders and among your grant team itself to begin with. So making sure that everybody on the team has an idea of what's included in the sustainability plan or might be involved in the process of developing the plan. And this is something that you can share with them, share with your stakeholders, kind of use it as a tool to get input on from everybody. And really be able to communicate it. The other thing that we encourage you to do as well is if you're working through developing a written plan, to share it with your SAMHSA GPO so they know that you're really planning for sustainability and thinking about it, and to also share it with your prevention specialist at SPRC, and feel free to ask them if you need any additional help or support in getting it completed. So I'm actually going to tap on Rachel Burns from Pensacola, who was willing to be a volunteer for us today as we walk through filling out the picture worksheet. So hopefully you've all located your grant objectives. What we're going to do with Rachel today is actually just take one of the grant objectives that they have established as part of their program and walk through answering each of these questions. So Rachel, I just want to make sure that you are unmuted as well.
Hopefully, can you hear me?
Yes. Yep, I can hear you. Great. Yeah, so the first objective that we're going to focus on from Pensacola State College's grant program was to increase the amount of training to Pensacola State College students, faculty, and staff on suicide prevention and mental health promotion. So Rachel, were there any key areas or sub-objectives related to this program that you had thought about?
No, not really. I mean, I think we were thinking pretty about gatekeeper training, although in discussion of this with some of my colleagues, we did talk about some of the other trainings that had occurred prior to the time that we received the grant, which were PTSD seminars and trainings for instructors to help them deal with students who have PTSD in the classroom or people with aggression issues, but we didn't have any gatekeeper training.
Okay, so as a part of the grant, the training was really the gatekeeper training focus, but you had done some sort of investigation to see.
And we use Campus Connect, and we have purchased At-Risk through Cognito, but we have not implemented it yet.
Okay, great. So I guess we'll focus on Campus Connect since that's the one that you've been working with so far. So moving on to the next question, in terms of if the objective was successful and how do you know?
Yeah, this is pretty clear cut for us because we definitely know it was successful because our goal was to increase the amount of training, and since nothing had been happening before we got the grant, I think we can pretty much say it was successful because we did train 25 trainers and have been able to conduct gatekeeper training since then, have trained a total of 90 individuals. And so we were successful in that we had nothing prior to the grant. So any increase was a success in our view.
Great, and then did you have any other data or impact measures?
I didn't. I had some trouble accessing SPDC, so I wasn't able to get those measures. But that is something that we've realized in the process of working on this sustainability plan, as well as at the grantee meeting, realizing that we have to do a better job of utilizing the data that we have. And most of our other data would be kind of anecdotal. The impact, I can tell you that there have been, individuals, we get feedback from individuals who have gone through the training who are so relieved that they actually have something practical that they can use.
Yeah, and I think that's an important piece. I know that, some of the stakeholders for sustainability will really just want to see sort of the quantitative pieces about impact and numbers trained, but also using the stories that you get through some of that anecdotal information can often communicate your successes as well. So let's move on to the next question. What challenges changed the objective or may have prevented its success from as much as you would have thought it would be? And did you modify your approach?
There were a couple of challenges. One is that the training itself is a 3-hour training, And I think most of the trainers have found that that's difficult for us to maintain. And so we've modified it to a 2-hour training. Um, and, for the most part, I think we're satisfied that we haven't cut anything essential from the training. Also, one of the challenges was that the trainers that we trained initially, some of them, they were from different areas, which was great. So we had some faculty, we had student services, personnel, and we even had 3 outside the college individuals, 2 from our local community mental health agency. Some of the initial trainers really didn't kind of participate in leading the training. Later, it was hard to get them to engage in actually doing it, so it ended up being kind of a core group that were doing most of the training. And what we realized was, well, I guess that's the next question, did we modify our approach? We changed our training strategy to, instead of offering it as a professional development and just kind of leaving it wide open, we targeted specific groups, and that gave us the benefit of not only getting individuals to come to the training. So, for example, the testing department would train as a whole group. The advising department, actually, we have a gatekeeper training set up for them. That also gave us the advantage of having the trainers I could say, well, I have a need for a particular training instead of waiting for them to initiate to do a training. Does that make sense?
So there were groups that would be requesting a training.
Yeah, and so I could say I need a trainer for this date and time for this group, and that seems to work better than just kind of asking trainers to set up trainings themselves.
I know that we'll be actually spending a whole session talking about training in a future sustainability series meeting, because I know that there's often different strategies that people have used but that sounds like a great one to sort of just pair the trainers with requests for training.
Yeah, no, it certainly it seems to have worked very well for us. We have actually, been asked to provide training for our whole financial aid department, the cashier's office, and our veteran services departments in the fall. So it looks like targeting departments is really going to help us increase the amount of training.
And then were there any other modifications? I mean, it sounds like adding Cognito was also another piece of your
Yeah,
argument.
hopefully it will be. There's no way to assess that yet since we haven't really implemented it, but the idea behind having Cognito as an option is that we know that not everyone wants to do a face-to-face in-person training or has the time, and so having Cognito's at-risk training, which is, I believe, about 45 minutes online, there are some who that's the only one that they would choose. So I would rather someone do a 45-minute online training than get no training at all. So we're trying to sort of cover all our bases, but I can't assess how that's going yet since we haven't offered it.
So I'll go ahead and move to the next question. So which part of the objectives work had momentum? What has helped it move forward, and whose support has been key?
I think focusing on training the departments and focusing on offering it to specific groups on campus. That's really probably what has given it the most momentum. And then, as word of mouth, people talk about what's happening at the training, that's also helped us move it forward. And especially having department heads on board, I've had the opportunity to present at academic department head meetings. That has also helped.
And then into the last column, so what big picture long-term outcome are you trying to change with this objective?
We are trying to increase recognition that suicide is preventable and also increase the ability of faculty and staff to identify vulnerable students and refer them to resources.
I think the last column is an important piece in terms of thinking about overall outcomes. And we often have these in terms of increasing sort of a certain protective factor or decreasing a certain risk factor. But I think our strategies are often focused on changing the behavior of other individuals who could help increase help-seeking behavior or increasing the amount of people who get into services by getting those skills to refer them as well. So the next thing that we're going to do, we're actually going to tap on all of you in the group to help work through another one of Pensacola State's objectives. So we can go ahead and so now I'm going to ask all of you, so the next objective that we're going to discuss is increasing help seeking among Pensacola State College students and reducing stigma for seeking care for mental and behavioral health issues among students. So we're actually not going to walk through each of the columns like we did with Rachel for the first one, but we just wanted to get your input on the last column. So looking at what is the big picture long-term outcome that you're trying to change with this objective, and feel free to go ahead and tap into the chat box. So we just wanted to get everybody else's input on when your objective is to increase help seeking, what is the long-term outcome that you're hoping to change? And and when I say outcome, we're thinking about the suicidal student or the suicidal individual. What are we trying to increase or decrease in terms of the change in behavior that would affect their condition? Assuming that many of you probably have some objective that's somewhat similar to increasing help-seeking behavior of some kind or another. Great,
Sheila, this is Julie. As folks are typing in, maybe you could share what some of the key areas are, or Rachel, you could just share what some of the key areas are that you're using under this objective.
Oh yeah, sorry about that. Yeah.
Rachel, can you clarify? Did you say that's Judith?
So the second column where it says key area or sub-objective, I know that you've had some activities that have sort of been related to kind of outreach or promoting information. If you could just share what some of those items have been.
Oh, sure. A key partnership has been working with student activities on campus to participate and kind of piggyback off of a lot of their events so that we would maximize participation. And so we would be at all the welcome back events on campus each term, as well as end of term and particularly end of academic year events, as well as having some events during Suicide Prevention Week.
So one piece of this is partnering with other people to combine efforts related to their programming or activities that are involving students. And I see that Judy had mentioned increasing awareness of the National Suicide Prevention Lifeline, which I'm pretty sure you guys are doing as well.
So Sheila, I wanted to share that one thing that can sometimes be a little bit confusing when filling out this big picture worksheet is um, some people have objectives like increasing help seeking and reducing stigma, and some people have objectives like increasing awareness of the National Suicide Prevention Lifeline. And so some people, because of that, they're not sure, well, what do we put in the long-term outcome, um, you know, when there are these different kinds of objectives? What are the risk and protective factors, um, that we are addressing in the long term?
Yeah, that's a really great point. So I think when we say, increased help-seeking behavior, or if we were thinking about long-term outcomes, if we go back to what are some of the risk and protective factors for suicide that we're kind of working to increase or decrease. So I think overall getting more students into services, we know that access to mental health care is an important protective factor.
You can kind of see that there are different key areas, and I put create marketing materials, and this may not be, Rachel, this may not be one that you're doing at Pensacola State, because not everyone does this kind of thing, but that these are different kinds of examples of key areas or objectives that people might have relating to help seeking. Another one is increased awareness of location, interest, and use of counseling centers. So that might be another long-term outcome. That one kind of leads to overall students have more services, if you will. So I guess I'll just point out that sometimes when you have these broader kinds of objectives like increased help seeking and reducing stigma, that actually may be your long-term outcome. It's just that the way that you have your objectives written, it's more focused on the outcome rather than the more nitty-gritty. So as people are filling this out, we just wanted to give some examples that will show, you know, some questions that people often have about this. Well, if my objective is to increase help seeking, then what's the outcome? Because, um, isn't that the same as the objective? And sometimes that might be, but your key areas, such as marketing the National Suicide Prevention Lifeline or creating other kind of social marketing materials, those might be different. Or you might say that your outcome is, okay, students getting more services. So we just wanted to point that out. So some other folks are typing in some other really great long-term outcomes. Sheila, should we maybe move on to the example from Kiowa?
Could we go ahead and go back to the slides? Thank you. So I know that we had a question earlier about having written plans in place, and this is actually an example from one of our tribal grantees that you can access their whole written plan on the private pages of the SPRC website. And so, like Julie was saying, that sometimes depending upon how your objectives are written, um, it might be confusing on whether it's an objective or an outcome. And so we just wanted to use this example because I think this is often something that many grantees do. So developing, or their objective was to reaffirm and continue the Area Teen Suicide Prevention Task Force with key stakeholders to provide continued community assessment, reevaluation, and effectiveness of program and longevity of program activities. So this objective is really focused on the task force and the people that they convened of the key stakeholders who are going to guide the work and also play a key role in sustaining it afterwards. So as you'll see in the last column where they have their long-term outcome, the outcome was collaboration of various community entities that work together towards suicide prevention. So the outcome and the objective were really pretty similar, but the outcome in terms of ongoing collaboration was what they saw as being able to help continue their sustainability efforts in terms of suicide prevention. And so they would have gone through to see more details about the other columns and the information that they included about how did they know it was successful and what things did they change and all of that. You can see that information there. And there are written sustainability plans for the other grantee groups on the private pages as well. So if you are looking to sort of see a completed one, I encourage you to take a look over there. So now what we're going to do, just briefly, we're going to take about 8 minutes to do this, is the Big Picture Workbook. If you don't already have a copy of it, sort of close by on your computer, you can actually download it on the box on the left where it says Downloads under the discussion box. So I'd like you to just pull that up and pull out your grant objectives and start to do the job of plugging in your objectives into the worksheet and then thinking about your outcomes and maybe thinking about how you might answer some of those other columns as well. So we're actually going to give you just about 8 minutes right now to get started with that.
As I mentioned at the beginning, the idea is this really helps you take a step back and look at the big picture. What is working? What maybe has some challenges? Who are those key supporters that you can leverage? What's the ultimate goal that you're trying to get to? And this will really help to set you up for some of the next steps in thinking about, well, what is it that maybe is already sustained? What should we prioritize? What maybe isn't as successful and maybe we should let fall by the wayside, etc. So I see that Jonathan is typing. I'm not sure if you have a question, but feel free to also use *# if you want to speak aloud. So Jonathan's question is, can some of the information come from TRAC? And so certainly some of the information can come from TRAC, and that may be helpful in developing your communications to your partners, your tribal council members, your higher-ups in your department, campus administrators, etc. If you have any local evaluation data, like if you assessed any impact on suicidal behavior or on intentions to refer people, different kinds of more enhanced evaluation methods, that's also really useful information to be able to show not only number of people have trained, but what impact did those trainees have. That's also really useful information to be able to show to others in your communication for ongoing funding, ongoing positions, for example, if you're doing school-based screenings, can you show the school what effect those screenings have had, number of students at risk who have been identified and gotten connected to mental health services? But it's also for your own internal evaluation or kind of conferencing with your partners to say, is this something that we feel like we should continue or not? Is this being effective and successful? And later on, we're going to be looking at, well, where are we getting the most bang for our buck, so to speak? Which are the efforts that are really important to sustain? And the outcome piece is going to also help you think about taking that, looking at a comprehensive approach to suicide prevention, and we'll talk more about this next time, and what pieces of a comprehensive approach are we really hitting, and are there areas that are missing and maybe we need to fill in some gaps? So it's a great question. Any additional questions? So it looked like we had a question, but then Judy stopped typing. So Judy, as we're wrapping up, feel free to keep chatting that in if you do still want to ask a question. And feel free to be in touch with us or with your prevention specialist, as you're starting to work through this big picture worksheet, if you have questions that come up. But really, this is where your buddies are going to come in. So the next meeting is going to be on July 8th at the same time. And in the meantime, we're asking you to take this big picture worksheet and complete it for the best you can for all of your grant objectives. There are some examples, as Sheila mentioned, on the private pages. There are 2 examples for each type of grant, tribal, campus, and state. And so those may provide some helpful thoughts as well, just to see how other folks have completed those. And then once you've completed them, we're asking that you exchange them with your peer site, and that was the list that was emailed to you earlier today, and give each other feedback on both, does this make sense in how you're filling it out, or are there ideas that you want to think about? This looks like a great objective, or this looks like it's going really well, or, oh, well, did you measure, have you kept any anecdotes or any stories about the people that this has affected, or, um, this seems like maybe it's not going so well, maybe this is something that you don't really want to think about continuing, things like that. If your buddy was missing this first meeting, feel free to talk to your PS about that instead. Um, and again, you'll need to log in to get those private pages examples. And there's a forgot password tab in case you're having trouble remembering what your password is on the SPRC website. In terms of reading, if you haven't read it already, pages 29 to 30 of the sustainability report that we had asked folks to read if they had a chance before this meeting, it really has some concrete helpful strategies. And next time, we're going to be working on steps 3 and 4 of this sustainability planning process. So we're asking you to read that part in the sustainability guide for next time. And between the July 8th and the August 5th meeting, we're asking you to try and bring your partners together to help you, as a grant site, prioritize which pieces to continue and which pieces to maybe let fall by the wayside, as well as that to get them on board to potentially take on some pieces of the work. So thinking about that time frame, if possible, to have that meeting and setting that up now. After today's meeting, there's going to be a short evaluation coming your way. This is a new series and a new format for us, so we definitely want feedback on this pilot. And Nicole asked if we could give the buddy site information match again, and we will email that to you after the fact. So I want to thank everyone so much for participating. We look forward to seeing you at the July 8th meeting, and let us know if you have any questions in the meantime. So, and Sheila just uploaded the buddies list in the box below, so we'll keep this meeting open for a couple of minutes before we close it out. Thank you, everyone, and have a great rest of